Immune Deficiency Diseases, Severe Combined Immunodeficiency by Peter Kim. Introduction. There are many different types of immune deficiency diseases. However, one of the rare but deadly types is severe combined immunodeficiency syndrome, which is also known as the boy in the bubble syndrome, aka SCIDS. I will refer to it as SCIDS from the rest of the presentation. Mode of inheritance. There are many different types of SCIDS. However, the main type, the X-linked severe combined immunodeficiency, has an X-linked recessive trait. Therefore, only boys can have this kind of SCIDS. Other types of SCIDS are mainly autosomal recessive traits. Clinical description of the disorder. SCIDS is a rare but potentially fatal syndrome in which there is a combined absence of T lymphocytes and B lymphocytes. And on occasion, there are also a lack of NK lymphocytes. Boy in the bubble. This is a case in which a patient with SCIDS has to be enclosed within a bubble or a hospital room that is completely sterile in order to keep a healthy immune system. I will go into further detail later. SCIDS is basically a disorder in which your body cannot produce the necessary lymphocytes to fight diseases. This can be physically limiting if you are in a bubble or a hospital room. However, outside of that environment, the patient may die. Because the most common type of SCIDS is the X-linked severe combined immune deficiency, SCIDS is most common in boys. However, girls can also inherit SCIDS. Boy in the bubble, David Vetter. The parents of David Vetter had one son that already died because of SCIDS. Still, they took a 50% chance that their next son wouldn't, and they had David. However, David was also diagnosed with SCIDS. In order to give David a healthy immune system, the doctors tried a bone marrow transplant with his sister, Catherine. However, it turned out that Catherine was not a match with David, and the bone marrow transplant was a failure. Less than 10 seconds after birth, David was put inside the bubble. Life in the bubble. Because David had to be enclosed inside the bubble at all times to survive, life was very difficult. Everything needed to be disinfected before it could enter the bubble. He was always handled with caution and through plastic gloves which were attached to the walls of his bubble. Loud motors made communication difficult between David and others. Although his parents did the best to keep his life as normal as possible, David still wanted to participate inside the outside world. The death of David. After many years, David's situation became unbearable. He was becoming a teenager and was psychologically unstable due to no human contact. Expectations for SCIDS were no better than from when he was a baby. When David was around 12 years old, the parents took one final risk, another unmatched bone marrow transplant with Catherine. David was taken outside of the bubble and was operated on. However, David became sick for the first time in his life. It turned out that Catherine's bone marrow contained previously undetected traces of Epstein-Barr. The virus spread and produced hundreds of cancerous tumors within David's body. 15 days later, David Vetter was dead. David, throughout his life, wanted to drink Coca-Cola. However, because of sterile issues, he was not allowed to. When he was finally brought outside the bubble for his operation, David asked for a can of Coca-Cola. However, doctors refused his request on the basis that it would be too dangerous. Treatment. Because infants inherit SCIDS, isolation from chickenpox is very essential at a young age. Although chickenpox may irritate young, healthy people, for infants it can become deadly. Contact with anybody should be very limited, and good nutrition is essential. Intravenous feeding may also become necessary. Immunoglobulin replacement therapy may also help by providing B lymphocytes. Bone marrow transplantation proves to be the most effective method of maintaining a healthy immune system. Gene therapy is also currently being explored and researched in order to make it safer. However, it is not being actively used. Bone marrow transplantation. The most successful therapy for SCIDS is through immune reconstitution by bone marrow transplantation. An ideal donor is a perfectly healthy HLA-type matched normal brother or sister. Although half-matched transplants have been successful, the chances rise with matched siblings. It is best done within the first 3.5 months of life. The overall survival rate for bone marrow transplants is between 60% and 70%, but if from a matched sibling, it is over 85%. Out of 161 patients, the overall survival rate was 77%, but out of that 161, 48 that transplanted before 3.5 months had a survival rate of 94%, while the 113 that transplanted after 3.5 months had a survival rate of 70%. Detection. SCIDS is first suspected in children as it is an inherited disease. Detection through general peripheral blood lymphocyte count is very effective. Specific lymphocyte count and lymphocyte function tests may also be done to prove otherwise. Diagnosis of SCIDS can be made utero if there has been a previously affected infant in the family and the molecular defect has been identified. However, utero diagnosis is best effective on cord blood. Screening of cord blood right after birth is now possible today with modern technology. This is the safest and most advised method of detecting SCIDS. Bibliography. Thank you for watching this presentation.